members of the Presidential Task Force, distinguished ladies and gentlemen of the press, the briefing of Wednesday, 29th April 2020. We further elaborated on the key aspects of the President's broadcast and reiterated his determination to lead us to a victory over the pandemic. This has informed continual dialogue and experience sharing with development partners and friendly countries. A reassuring telephone conversation between Mr. President and President Donald Trump of the United States of America, during which they exchanged ideas on emergency responses, further highlights the global response to this pandemic and underscores the collaboration between all nations in solving the problem. We therefore welcome and appreciate the offer of ventilators and other items by the American President. In line with Mr. President's directive in paragraph 34 to 41 of his broadcast, the Presidential Task Force has developed sector-specific guidelines. The gradual reopening of the economy will span a total of 6 weeks, broken into 3 tranches of 2 weeks each. The first strategy is designed to reduce the pains of socioeconomic disruptions while strengthening our public health response, which would ultimately reduce the recovery of our economy and provide succor to the poor and vulnerable. To underscore the collaborative efforts with sub-national levels of government, they are encouraged to provide leadership in engaging relevant associations responsible for various sectors, e.g. market associations and transport unions, for orderly and effective implementation. Similarly, I want to emphasize the need for security agencies to strictly enforce these new measures that have been put in place. Following the pronouncement of the President, it has become necessary to provide initial clarifications for Nigerians on some of the new measures, such as the overnight curfew, interstate travels, and related matters. Specific details will be provided shortly by the National Coordinator. For the avoidance of doubt, the following clarifications are provided. The overnight curfew is applicable nationwide. 8 p.m. Monday, 4th of May, 2020. Interstate travels are banned except for the movement of goods, agro products, petroleum products, essential services, ECG, such as directed by Mr. President. Third, the management of various offices, premises, and businesses that will be gradually reopened are mandated to ensure that the following preparatory steps are taken. A, fumigation and decontamination. B, arrangement made for physical distancing. C, provision of hand sanitizers and hand washing facilities. D, application of the policy of mandatory use of face masks. E, provision of thermometers for temperature checks. F, consideration must be given to persons living with disabilities while making all these arrangements. G, increased communication with staff on COVID-19 and the measures put in place. And H, any other measure that may be peculiar for the organization or the sector. 4, mass gatherings of more than 20 persons outside of workplace is strictly prohibited. 5, control access to neighborhood of economic activities will be enforced. 6, mandatory temperature checks will be conducted in public places. 7, social distancing of 2 meters to be maintained between people in workplaces and other public places. 8, all passenger flights remain under ban. And 9, mandatory supervised isolation of persons arriving from outside the country for at least 14 days. State governments, in cooperation with security agencies and relevant trade associations, are strongly advised to ensure that these measures are strictly enforced. I must emphasize once more that the easing of restrictions and introduction of revised measures do not amount to the end of the battle against COVID-19. Indeed, it signifies the need for more vigilance, stringent compliance, so that we are not lured into complacency capable of diminishing the progress we have made so far. In furtherance of tackling the situation in Kano, the technical team of public health experts sent by the Presidential Task Force has begun the evaluation of the situation in the state, working in collaboration with the state's team. I'm pleased to inform you that the operationalization of the laboratories in the Aminu Kano Teaching Hospital and Bayero University Kano will considerably improve our response to the pandemic in Kano State. Additionally, 50 trucks out of the about 200 meant to be sent to Kano of assorted grains have been sent to Kano and due for delivery within the next 48 hours. The Presidential Task Force appreciates the cooperation of the Governor and the medical team in Kano. I need to, at this point, mention the role of research in this exercise. We must encourage our local scientists and deepen our capacity for research. There is a huge role for all the relevant research institutes to play at this time. The Federal Ministry of Health is coordinating the process in conjunction with the National Institute for Medical Research and the National Institute for Pharmaceutical Research and Development. We have received information on domestic and international claims about emerging inventions on COVID-19. These are most welcome, but scientific validation process and protocols will have to be followed. We are open to all options for the good of humanity. The Presidential Task Force appreciates the feedback, reports, and suggestions and constructive criticisms received from Nigerians on its activities. Through the WhatsApp platform deployed on telephone number 070-535-36666. We look forward to more interaction to enable us to improve on our work. Once again, we urge everyone as citizens to take responsibility for their actions so that we can collectively overcome the COVID-19 scourge. I would not fail to reiterate the need for Nigerians to please continue to adhere to the laid down adversaries. Once again, I appreciate the members of the press for your patience and our frontline workers for your invaluable contributions to the success of this war. The Presidential Task Force continues to receive donations in kind from different organizations and groups to support the fight against COVID-19. This morning, the Ansar-Uddin Society of Nigeria donated assorted food items. The Full Gospel Businessmen's Fellowship International Nigeria has also donated the sum of 10 million naira. The Presidential Task Force, indeed the nation, appreciates these gestures and assure the donors that the resources will be judiciously applied. In addition to the updates by the Minister of Health, the DG, Center for Disease Control, and the National Coordinator, ministers may also update you if necessary during this briefing. I now yield the podium to the Honourable Minister of Health to update you all. Thank you.
Shift a little bit, lift it. Thank you. Yeah. Secretary to the Government of the Federation, Honourable Ministers here present, Directors General, Directors, ladies and gentlemen. As of today, the 29th of April 2020, 1,532 people have been confirmed to have COVID-19 in Nigeria. A record 825 tests were done, with 195 new cases identified, a high number that is distributed as follows: 80 in Lagos, 38 in Kano, 15 each in Bauchi and Ogun, 11 in Borno, 10 in Gombe, 9 in Sokoto, 5 each in Edo and Jigawa, 2 in Zamfara, and 1 each in Delta, Enugu, Nasarawa, Rivers, and the Federal Capital Territory. 255 persons have been successfully treated for COVID-19 and discharged to go home, and sadly, 44 fatalities have been recorded. The increasing figure of confirmed cases underscores the ongoing community transmission, which is a major challenge, and again necessitates a call on all of us, all citizens, not to take COVID-19 lightly, but to take ownership of initiatives for non-pharmaceutical interventions with strict adherence to public health advisories, which is to maintain social distance, practice hand and respiratory hygiene, avoid crowded places, and wear your mask or a face covering when you leave your house. These and other related measures are critical and an integral part of the strategy to ease restrictions as from 4th of May. I urge community leaders and traditional rulers to help to ensure compliance in their domains, because failure to comply can have undesired effects. Another pressing urgency is the need to provide and prepare isolation centers and more bed spaces in all states of the Federation. I wish to apply to each state authority and Federal Capital Territory to give first-line attention to this requirement in order to meet expectations and obligations. As testing ramps up, the need will become more and more obvious. It should therefore be prioritized so that we are not taken by surprise. I should take the opportunity to request elected distinguished senators, honorable members of houses of representatives and assemblies to also get involved in this effort to ensure compliance, to participate in disease surveillance and notification efforts in their constituencies, and to actively support the drive to rapidly increase bed spaces for isolation and treatment in their states. I shall also strongly urge those who test positive for COVID-19 to cooperate with the directives of authorities on isolation so as not to constitute a risk and a cause for public concern. We have completed plans to start training and capacity building of much needed intensive care workforce for various parts of the country. I am pleased to report a fruitful interaction of the Federal Ministry of Health delegation to Kano yesterday. They were well received by His Excellency the Governor and have been able to conduct an appraisal of the situation and to start working on outlines of providing technical support to the state COVID-19 task force in several aspects, as well as also planning capacity building for the frontline health workers. They also met with many influential community leaders who all expressed willingness to support the effort of the government. A full report from the team is yet to come. I shall, as usual, use this opportunity to call on our healthcare workers to continue to render service to our people while adhering to laid-down standard infection prevention and control measures. An advisory on case management has been developed and is accessible online. NCDC has also released guidelines on the management of the dead who fall victim to COVID-19. I shall close by, as usual, reminding you all that arresting the spread of this virus requires our individual and collective effort, and reiterating our public health advisories to stay at home, to avoid crowds and large gatherings, to practice physical distancing by strictly maintaining a distance of at least 2 meters between people always, to use non-contact greetings, and the elderly and anyone with pre-existing medical conditions such as hypertension, tuberculosis, cancer, chronic respiratory disease, diabetes, cardiovascular disease should not attend large gatherings or crowded places and should avoid receiving non-essential guests at this time. Also use your masks and face coverings over your nose and mouth if you must leave your house. Resources and real-time information on COVID-19 can be found on the social media handles of Federal Ministry of Health and NCDC. Thank you for your attention.
Chairman of the Presidential Task Force, Honourable Ministers, ladies and gentlemen of the press, good evening. Today I've chosen a slightly different topic as usual, given the time of the year it is. It's one about sacrifice. We all know that this is the holy month of Ramadan, and it's marked by the observance of fasting. It is a season that encourages our Muslim brothers and sisters to unite and break their fast together every day. It is also customary for our Muslim brothers and sisters to go to mosque for congregational prayers and to listen to sermons. These are values and practices that I know that every Muslim holds very dearly. So this must be a very difficult year, because we are asking that Ramadan be done differently for a public health reason. So it's in recognition of the immense sacrifice being made that we published an advisory on how to do this safely during this period of Ramadan. And if you look at our website, www.covid19@ncdc.gov.ng, you'll see a new advisory on how to manage this, at least from the public health perspective. But I really want to also recognize the huge sacrifice it takes to change a way of life and change your day-to-day But the other group of people I'd like to mention today are healthcare workers. Across our country, many people are away from their families. Many people have been away from their families for 6 weeks to 2 months. They work very hard with no end in sight at the moment. But yet, they have no option. Every morning, they have to wake up and continue pushing. So wherever you are today across Nigeria responding to this outbreak, whether you're in Kano or in Abuja or in Lagos, in Kogi, in Cross River, I'll ask you to persevere. Your work will see the light at the end of the tunnel. Yesterday, after work, I spoke to a number of people in my own team that had sadly become infected themselves as part of the response in the line of duty. I spoke to them. We ended up in a situation where they were the encouraging. I called them to encourage them, but they ended up encouraging me and encouraging this PTF to keep pushing. That our work was so important for the future of our country, and they wanted to keep at it. So even though they're isolated and some of them in hospitals, they're on their laptops working, contributing to the response. They said it's better to do that than to sit idly, watching TV or thinking about their fate. So today I really want to end this very short set of comments, thanking all of them, whether you're working clinically, whether you're a public health surveillance officer, whether you're a driver, whether you're an ambulance driver or driving a pickup, or any part you play in this response. Not to give up. We need all of us, we need all of you to keep pushing. And my final words really are to their families. Many of them have families at home, knowing every day their husbands, wives, children go out to do contact tracing, to manage patients, to drive vehicles, to drive ambulances, that we're in this together. And we'll do the very best to protect you from harm and do the very best to get our country back on track again. Thank you very much.
The Chairman, members of the Presidential Task Force, ladies and gentlemen of the press, good afternoon. Before I go through the details of the lockdown protocol, I would like to first of all start by talking about our donors, particularly those that have been helping in the distribution of palliatives and those that have contributed in significant amounts for the fight against COVID. First of all, I would like to continue to encourage donors to ensure the safe distribution of palliatives across the country. It is particularly important that donors ensure strict physical distancing, ensure that their personnel are trained on basic health and safety protocols. This will stop us from having situations where we are potentially putting persons at risk of transmission of COVID. From the point of view of persons that are positive for COVID, again, I would like to urge these persons to please present themselves to clinical setups. The key symptoms are fever, which occurs in about 80 to 90% of cases, a cough, which happens in about 2/3 of cases, and a shortness of breath. There are other unusual symptoms, such as loss of smell and taste, associated with cold-like symptoms. In these situations, it's particularly important that we take measures to move persons out of the communities and into care so that they can be looked after properly. We need to take personal responsibility of our health, but we also need to take responsibility for the health of our communities. I would like to, before I go on, I would like to acknowledge the contributions of the following: MTN, UBA, Friesland, Union Bank, Food Relief Fund, and the Ansaruddin Society. We're very grateful for your support. In terms of the details of the lockdown protocol, the Secretary to the Government of the Federation has already outlined some of the guidelines we have in place that haven't really changed remarkably. And I think the most important thing I wanted to emphasize is, even though we talk about easing the lockdown, in actual fact, we're not really easing. We're just shifting from one set of interventions to another, because we are really still far from controlling this epidemic, and we need to continue to work hard, all of us, to make sure that the pandemic resolves. So, first of all, the issue of curfew. Effective from the 4th of May, as Mr. President announced, there will be an imposition of overnight curfew nationwide from 8 p.m. to 6 a.m. General movement outside the curfew periods, people may go out for work, to buy necessary food, and for exercise. But we are strongly advising persons to restrict themselves to their local government areas, except for those that live in metropolitan areas where this will be very difficult. Unless, of course, you're going out for critical reasons such as healthcare and work. For interstate travel, Interstate travel is restricted to only those involved in the supply chain and services such as goods, agricultural products, petroleum products, courier services, relief items, etc. And we'll provide that detail. From the point of view of intrastate, that is within state borders, there are certain aspects that will apply across the board. One is to ensure that all, whether you are businesses or you are transport companies, etc., you make sure that you provide hand sanitizers to your customers. Any person going into the public will be expected to use non-medical face masks. We will introduce temperature checks. We will ensure that respiratory hygiene is followed, and in general, the restriction of mass gatherings to not more than 20 persons. In addition to this, we will, from the point of view of agriculture and rural development, companies involved in food processing can commence operation. In construction sites, critical roads will be allowed. Construction of critical roads will be allowed, but waivers will be provided by the state governments to enable movement. For the manufacturing and pharmaceutical industries, we will encourage shift work and limiting staff to only 30 to 50% to maintain social distancing. And pharmacy shops may remain open overnight. Banks will be allowed to open, but there will be restriction in the opening hours to between 8 a.m. and 2 p.m., together with all the other preventive measures I have already mentioned. For government offices, government staff will be allowed to resume from the 4th of May, but it will be based on specific grade levels and specific days so that we can reduce the amount of congestion that we might have in our government offices. And we will be discussing further with state governments to make sure that we have a common approach to this. Neighborhood markets will continue to open with the same standard restrictions that we have applied in the past, as well as supermarkets and retail stores. Restaurants will not open to the public, but will be allowed to engage in home delivery of food. Academic institutions and social engagements, schools will remain closed till further evaluation. Schools are encouraged to continue with e-learning and virtual teaching. Social activities such as the use of recreational parks, communal sports, concerts, social parties, and movie theaters will be suspended until further review. There will be other general pieces of advice. So, for instance, discouraging persons above the age of 65 and those with comorbidities from commingling with the general public so that they protect themselves from catching COVID, because they're the ones that are most likely to develop severe illness. We will be providing additional details. Hopefully, the implementation guidelines and the protocols will follow over the next day or two to allow businesses and offices to prepare for these changes. Thank you very much.
Thank you very much. We have completed the technical updates. We shall now take the questions.
Good evening, the SGF, Honourable Ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My question is directed at the Minister for Health. Yesterday, about 195 cases were recorded. What could be responsible for the spike in the number of infections? Then secondly, is there any recommendations for Nigerians to boost their immune system against the COVID-19? Thank you.
Good evening, sir. My name is Juliana Taiwo. I write for the Sun newspapers. SGF, sir, and the coordinator, I know you just spoke about interstate restrictions. A lady who did a biopsy and it turned out malignant wants to come to Abuja for proper treatment and care, but she's based in Warri. How does she go about this? Because she needs to start her treatment immediately. Minister of Humanitarian Affairs, NAFDAC just debunked your claim that it was invited to conduct a proper test on the rice distributed to some states by Nigerian Customs as COVID palliative. Are you still insisting that the rice distributed are fit for consumption? That's all.
Good afternoon. Good afternoon, colleagues. My name is Azom Tonwebule. I report for NTA. My question is for the coordinator. Although you have mentioned part of it during your report about the banking operatives, but this morning I had the experience and I met other people there. They were shouting and there was chaos at the bank. Most of them, their ATM cards have expired and they couldn't get a new one. Those that don't even have at all are so disturbed how they could access their money, particularly as the salary has been paid. So I don't know what is their faith in that regard. Secondly, to the SGF, you made mention that specific attention should be drawn to you concerning the attention of the pensioners. And now some retired civil servants under the contributory pension scheme say they have not received their benefits since January 2019. They were told that the federal government has to pay its own contribution to PENCOM for onward payment to their pension fund administration before they get their benefits. They want to know when this will take effect and their benefits being paid because they are going through so much hardship. Thank you, sir.
Good evening, SGF, Honourable Ministers and the DG. My name is Femi Akonde. I'm a reporter with TVC News. DG, sir, yesterday you revealed what you called an ambitious testing plan, that is testing target, that is to test 2 million people within the next 3 months. But again, there's this widespread belief that once you're tested positive for the coronavirus, that life becomes very miserable. People are wondering what life is like in the isolation centers. What is a daily routine like for a coronavirus positive patient that is between and their medications? And the Honourable Minister for Humanitarian Affairs and Disaster Management, the President approved an expansion of the social register, and that was supposed to take 1 week for that to be done. What's the update? Has the register been expanded? Thank you.
Good afternoon, all. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'd like to direct my first question to the SGF. We know that our 4 weeks are now the 5th week of the lockdown. The enforcement, there was no punitive measures attached. Now that we are talking about the post-lockdown, you said you were calling on, while you were briefing, you were calling on security agencies to actually enforce those protocols. Are you in any way suggesting that we should attach some punitive measures to the enforcement this time around? The second question has to do with the cases reported, the 195 cases reported the last 24 hours. It's a kind of signal to what we'll be seeing after the lockdown is actually lifted. It tells me that we're going to see high number of cases after the lockdown. How prepared are we to actually cater for these huge numbers that we're anticipating? are the centers prepared enough to take in these numbers of people who may be testing positive going forward? I also like the Minister of Health to tell us about the gene expert machines. 2 weeks ago, you told us that one of the major problem that we'll have now is that you do not have cartridges, and you're expecting some cartridges. Do we have them now, or are we going to have them soon so that we can deploy these machines and add or to scale up the testing? Thank you.
Good afternoon, SGF, and honorable ministers and directors, my colleagues and Nigerians at home. My name is Wangoma Amarachi, and my question goes first to the Minister of Information, and the SGF can as well contribute to this. The hospitality and the tourism industry is one of the contributors to our GDP. And it seems that they are among the most affected industry at this period. Hotels are on total shutdown. Industries like the airports are closed. Travel agents and tour operators are at home. And for sure, they have lost revenues and jobs as well. My question is, what plans does the federal government have to support this industry, especially encouraging the domestic tourism after this period of lockdown to help the economy to grow back? Then secondly, for the DG NCDC, a lot of people have recovered and gone back to normal life. From all the indication, we have more than 500 people. Yes, more than that now that have recovered. And we're looking at people like Governor Sheyi Makinde, who made us to understand that he used fruits and vegetables to get rid of the COVID-19 when he tested positive. Is it not high time we look inwards and go orthodox? Seeing that a lot of people that have recovered from these, we still don't have a vaccine, we still don't have a cure for this. Is it not time we look inwards and look at what we have as regards to our locally made products and things at home so that we can actually have a cure for this disease? And then lastly, for the coordinator, you made mention of works resuming or a gradual release of the lockdown starting from Monday. And we didn't look at the measures for transportation. A lot of Nigerian workers still use the public transport. What measures do you have for those of us that are going to use public transport during this period? And for my DG NCDC in Igbo, ọtụtụ mmadụ enwetago arụ ike site na ọrịa COVID-19. Ha awụgo ndị nwetara onwe ha n'ọrịa. Anyị na-ele na-ajụ ọwa oge erube mgbe anyị ga-eji leba anya na ihe anyị nwere n'ụlọ. Ọbụna iji ọgwụ mkpọrọgwụ nke anyị nwere n'ụlọ iji leba anya na ịchọpụta ihe bụ ọgwụgwọ ọrịa. Ebe mmadụ dịka Gọvanọ Makinde kwuru na ya ji mkpọrọgwụ o nwetara n'ụlọ na ihe oriri nke o riri na mkpụrụ osisi nke ọ tara wee gbuo onwe ya. Ọwa ya enweghị ike ileba anya were mkpụrụ ọgwụ ndị anyị nwere n'ụlọ iji chọpụta ọgwụgwọ ọrịa. Ndewo.
Good afternoon, sirs. My name is Femi Ogunshola. I work with the News Agency of Nigeria. So a concerned parent sent it to me, sir, and that is directed to the Minister of State for Education. My daughter is in Russia for a scholarship program. Nigerian government hasn't paid them since January. What is delaying the payment, sir? Then to NCDC, DG, sir. Cross Rivers State said it will quarantine NCDC team coming to the state for 14 days. What's your reaction to this? And sir, earlier in the day, I was at Gariki Market. Sir, I discovered that there was no social distancing, sir. What can be done to this market?
Good afternoon, Mr. Chairman, members of the PTF, my colleagues. Good afternoon. My first question goes to the Minister of Humanitarian Affairs. Members of the civil society group have come up to say that at the moment, there are no financial palliative to the people, that what is ongoing is the usual conditional cash transfer. So I want you to react to that. And the second leg to that question is a coalition of civil society groups said they have written to you several times for you to come up with the names of those that have received palliative whatsoever, money or food items, for you to publish it on the website for people to know these people and talk to them. So I don't know how long that will take to come out. Mr. DG, sir, we have this allegation coming in from Kogi State, from the state government, saying that your staff in NCDC are appealing to them to come up with figures, even when they do not have cases of COVID-19 in that state. So I wanted to react to that. And also in Cross River State, we hear the Commissioner of Health coming up with that same allegation, saying that your staff send text messages to them for them to come out and say they have COVID-19 in those days. So I wanted to react to that. Mr. Chairman, sir, the NLC president have advised his workers to protest if governors tell them to reduce their salaries, those that are in the front line fighting COVID-19. I want you to react to that also. And for the Minister of Environment, last week you told us that you are working with the Ministry of Aviation to decontaminate about, I think, 124 aircraft and some other places. I don't know, want to get update on that. And finally, I have this appeal from someone in Abia State. He said, at the moment, there are mysterious deaths in Abia State, and there is big sorrow of that issue. So he wants NCDC to come to their rescue in that state at the moment. Thank you.
Good afternoon, Chairman and members of the Presidential Task Force and Nigerians at home. I want to ask, my name is Mitaire Ikwen of the NTA. This question goes to Dr. Sani Aliu and members of the task force. As managers of the pandemic, can you give more explanations into the phased relaxation of the lockdown? Because as at yesterday, we witnessed more cases, the highest in a single day, and we want to know why we are going into phased relaxation of the lockdown. Is it for economic reasons? Is it because we have come to the peak of the pandemic, or the curve is going higher? So Nigerians want more explanation. Then for the Minister of Humanitarian Affairs, Disaster Management and Social Development, you told us days back that 279 trucks of grains have been distributed to the lockdown, the 3 lockdown states. We want to know an update or progress report on the distribution of grains so far. Then for the NCDC, one of our colleagues who is monitoring at home wants to know the number of NCDC staff that are down with COVID-19 and in isolation at the moment. Then for the question asked earlier by my colleague on pension for the SGF, she is requesting that you please also answer in Hausa. Thank you.
Thank you. We have taken all the questions. We will take responses in the following order. The Honourable Minister of Health, the DG NCDC, the National Coordinator, that's for the technical side. Then we'll take the Honourable Minister of Humanitarian Affairs, Disaster Management and Social Development before we take the Honourable Minister of State for Education. The SGF will round it up. We begin with the Honourable Minister of Health.
Good afternoon again. First question is about why the cases increased from 105 we announced and to 195. It is due to two things we look at. First of all, the improvement in testing, case finding. You recall that the Director General of Nigeria Center for Disease Control has the ambition to be able to do 2 million tests within the next 3 months. That means that there is a renewed effort to do more, let us say, aggressive testing, house to house, and also following any clusters that are of interest. So you increase the testing and you also get more cases. There's, of course, the notion that the strong notion that community transmission is going on very strongly and therefore increasing the cases, giving you something to find. As for boosting immune systems, there are many remedies that are said to boost immune systems. Some of them are well known. You are told about vitamins, vitamin C, A, you are told to eat fruits, you are told to eat vegetables. There are many things which are said to boost immune systems, which I also urge you all to do, to eat fruits, eat vegetables, and particularly citrus fruits, which are like oranges. But there are also traditional remedies that say that they boost your immune system. I receive almost every day a letter from traditional practitioners who are offering traditional medicines that they have put together and praising the quality and the efficacy of this medicine. Well, so long as they do not harm, we do not object. But I urge the Department of Traditional Medicine and Traditional and Complementary Medicine at the Ministry of Health to look into these ones and to work with the Nigeria Institutes for Pharmaceutical Research and Development, NIPRID. They are responsible for analyzing and finding phytomedicines, for looking into products of plant origin to see what is medicinal in there. So NIPRID will be able to find out actually what works and if it works. Well, the DG for LCDC will speak about life in the ISO Center. We have only been there as visitors. And the life, of course, is life in, there are halls where you have community living of those who are positive. We organize various activities. We're encouraging the treatment centers to provide mental health support because some people get bored, some people do not know what to do with themselves. So mental health support is provided, and some creative ones among them also create games and have fun and amuse themselves in there for the 2 weeks or so that they spend. There are those who are in single rooms who are in isolation because they have traveled and they're waiting for their status to be determined within 14 days, either through a test or through the fact that they have completed 14 days of observation. Those ones will be in a single room. For those who do not like being alone, it may not be very easy. But for those who are quite happy to be alone, who can work on their computer, who can look at TV, who can read books, it is not difficult. I don't think it is. But I think by and large, it depends on your kind of personality. If you're in isolation, some people will not be able to take it so easily. But again, mental health is provided there, and various methods of counseling are provided. With the gene expert machine, yes, we recognize the value of it because they are, can be very useful in the diagnostic effort. The gene expert machine, we have received over 100,000 cartridges. Or, sorry, we have not received, we have ordered. We are going to order over 100,000 cartridges using the Global Fund facility that we have through the country coordinating mechanism. And if we are able to get the biosafety cabinet for 26 of them, we can boost the number of active or activated gene expert machines in the country. So with over 107,000 cartridges, we can do a lot of testing. The gene expert machines we have are 4 modules which allow you to test 4 at a time. And the good thing about them is that they give you a result in a much faster time. Within 45 minutes, latest 1 hour, you have your result. So you can wait and get your result with the gene expert machine much faster. Yes, I think I've spoken about traditional medicine already. It pops up again another time. Thank you.
So thank you again for the questions. There was one, what's life like for a patient? I think there are quite a number of patients that have actually come out to tell their own stories on what life is like, for what it's been like for them. I know for sure that all the states, Lagos, FCT, and every state is working very hard to make sure that those admitted are as comfortable as possible, but they're still within hospital environments mostly, or treatment centers. So they're working very hard to make life as comfortable as possible. But I think it's up to the patients themselves to share their stories when they're ready. And on certain occasions, it might be up to the hospital to let journalists into certain parts of the hospital. But it's not really for NCDC to do that. The patient care has to be managed by the clinicians and the managers of those hospitals themselves. So we leave it to them to decide on when and how to make that public. But their priority, obviously, is the care of their patients. And that is always the priority of every clinician. The question on the use of alternative medicines for treatment. Yes, I'd just like to say that 95 to 98% of all patients will recover from this illness, irrespective of medical interventions. So depending on where you are, many patients are asymptomatic, like you know, they would recover. So all we need to do is keep them. The only reason we're keeping them in hospital or treatment centers is to prevent transmission to others as much as possible. So 5 to 15%, depending on where you are too, will have severe illness. Some will unfortunately pass away. But remember, most people recover. And a much larger percentage of everyone infected from this disease recovers than many other viral illnesses that we know. So I don't think we need to be as despondent as we appear to be. We're faced with a big challenge, yes, but it's obviously not immediately a death sentence. There was a question on how well people are adhering to social distancing. I've said severally here, this really is everybody's responsibility. For a pandemic of this nature, where really we have almost every state in the country now affected, has at least one confirmed case, and we're doing so much work, we can't go everywhere to ensure that everybody is 2 meters apart. If we deployed all the forces that we had in the country, we still would not be able to do that. So we cannot rely on the police, or the army, customs, to enforce something that we're able to do ourselves. So this is really a call for all of us to do the bit that we can to carry out the social distancing measures that we require from ourselves in order to prevent transmission. This is not punishment. Nobody has committed a crime, so this is just to limit transmission to one another. There's a question on if an NCDC team will be quarantined for 14 days if they arrived at any state. I mean, I think we're at this stage right now. Every state is at risk. So the idea that moving from one state to another leads you or qualifies you to be at higher risk, it really is no longer the case. We could have thought about things like that in the beginning of the outbreak. But now, the measures that we recommend globally for everyone. Whether the measures that the national coordinator just announced, he hasn't announced it for one state or the other. He has announced it for every state. So we're no longer looking at this as a disease with differentiated risk. We're looking at this as a disease where all of us are at risk. And whatever measures we have to do, we have to all do collectively, whether you're in the north or in the south, in the east or in the west. And if the risk is more or less all over, then there's no evidence for quarantining any group of individuals, be them NCDC staff or not, for moving from one part of the country to another. Finally, there was a question on the number of NCDC staff infected. This is not a question that anyone would answer. I never give out that type of information. We ask you to continue supporting all healthcare workers across the country, whether they're NCDC staff, Federal Ministry of Health staff, Lagos State government staff, or even private physicians. Some of them have actually been private physicians that manage patients without initially knowing that they had COVID-19. And it turns out later that that patient turned out positive, and you found out that you had actually managed the patient, and then you get infected yourself. So we actually ask for support for all of them, not just one category or the other. And I think the final question, or one of the previous questions in Igbo, was on the use of natural remedies for curing some of these, curing COVID-19 in some patients. That's him come na oizioku na ọrịa enweghị ọgwụ na-agwụ ya kịta kama ndị ga-adị mma inwe ọrịa, most people ga-adị mma. So onye ọbụla jishi ike na-eme nke ọ na-eme, ịnọkwa n'ụlọ ọgwụ ịnọ obere gị pụta, most people ahụ ga-emecha dị ha mma. So I'll end it for now. I think I've answered all the questions, and we'll go and continue work. Did I miss any of them? Can you remind me? Okay. Firstly, I honestly don't want to join issues. I wouldn't join an issue with any executive governor of any state in Nigeria. I think I made my position very clear yesterday. My role is to interpret the evidence the best way we can. This is not only about COVID-19. When we urge people to go for HIV testing, it's because nobody's written HIV on his forehead. The only way you can know whether you have this virus in the early days is to get tested. When we talk about, we've had the largest number of Lassa fever cases in Nigeria ever. We have it because we have become more aware, we're testing more, and we're finding more. The only way we can understand the scale of COVID-19 is by testing. And so it's really not a controversial issue. Everybody is agreed on that fact. We're pushed every day to test more. So I don't think my comments were controversial. My role is to continue supporting every state in Nigeria with labs, opportunities to test. Most states in Nigeria are asking us, pushing us, how do I get a lab? How do I test more people? And we'll continue to do this on behalf of every state. Yeah, I answered that. Our staff will make operational decisions as we engage with them. Thank you.
So first of all, I'll start with the issue of the unfortunate case of the lady with cancer who needs medical intervention in Abuja. As I said earlier, not all travel is restricted. We will allow essential travel. Our thoughts are with her. And if there's any way we can help, she should please get in touch. But we expect that the security services will allow her to come over, provided she has all the documentation she needs to show them. But certainly if there's an issue, she should please get in touch and we'll facilitate that. In terms of the banks, this continues to be a recurring issue for all of us. We have been in touch with the CBN governor. Moving on from Monday, banks will open. they will operate normal services from 8 a.m. to 2 p.m., so that's 6 hours, but there will be the usual restrictions we would expect. So, for instance, self-distancing, the use of temperature monitors, hand hygiene, and making sure that the capacity of the banking halls is restricted so that people do not, too many people do not come together. But we expect banks to operate as normal, really, apart from the restrictions that I have already emphasized. Release of lockdown, public transport. So outside the curfew hours, buses and motor parks will be allowed to open for some hours in a day, I believe 6 a.m. to 6 p.m., and taxis will also be allowed to operate. But because this is a respiratory viral infection, what we're actually trying to do is to limit interaction between persons. Because if you come in contact with somebody who's infected, it's a highly infectious organism, and you wouldn't really want to end up with COVID. And one of the best ways of preventing transmission is to put space between you and the other person who might be infected. So there will be regulations around reducing the number of passengers, for instance, in taxis. There will be rules around restricting the number of hours they can operate, which is why we brought in the curfew hours. And also the issue of hand hygiene and respiratory hygiene, etc. This is all directed towards reducing transmission, which is what we are really trying to do. But we will allow some semblance of transportation, public transport, to be available in the states, including FCT. So the final question was, why are we relaxing the lockdown? And as I said earlier, we're not really relaxing it. We are looking at modifying the current interventions we have. We're moving to more of a containment phase. If you may recall, when we imposed the lockdown, it was primarily for two reasons. One, to slow the progress of the epidemic, and two, to allow our health systems to get ready. So even internationally, if you look at the global scale, countries are struggling to decide when is the best time to do this. Some might delay for 6-7 weeks, some might open. But what is important is we continue to keep a strong focus and monitor the number of infections we are having, monitor where these infections are happening, and moving in fairly quickly to control them. Some of the measures that we'll be putting in place will be more strict with those measures, because if they are implemented as a bundle, they will have very similar effect to you staying at home. So for instance, if you maintain social distancing, hand hygiene, you use face masks, you avoid mass gatherings, and you do that consistently, you'll probably get a similar advantage to staying at home. Of course, we will continue to encourage those that are most at high risk of severe illness to stay at home. I think I've answered all the questions. Thank you.
Thank you very much. We will do a minor adjustment in the order in which ministers will respond to the questions. I will invite the Honourable Minister of Environment to come first, followed by the Honourable Minister of Humanitarian Affairs, Disaster Management and Social Development. Then the Honourable Minister of Information and Culture, after whom the Honourable Minister of State for Education will take his turn. Honourable Minister of Environment.
Mr. Chairman, colleagues, press, ladies and gentlemen, good afternoon, or good evening rather. Decontamination, disinfection, specifically as it affects the aviation sector. The aviation sector is such a specialized sector, we don't rush things. Last week I did say yes, we mapped out 125 aircraft and 13 airports. So far we have decontaminated and disinfected 2 aircraft. Why we are not rushing it, like I said, is because of the nature of the industry. It's a place that has such a redundant system of safety, so everything must be followed carefully. Even when we go to do that, we have to follow their lead, how and where to go decontaminating and disinfecting this aircraft in particular, and also, of course, the airports, areas where we should go in, when and how, and all that. So it's ongoing, is exactly what I'm saying. And because there are other facilities that we are decontaminating and disinfecting all across the country. So we go as, they are ready for us. Thank you.
Honourable Minister of Humanitarian Affairs.
Thank you, PS. Chairman of the PTF, Honourable Ministers, members of the PTF, distinguished members of the press. Let me start with the first question on NAFDAC. We still stand by what we said, because this was what was conveyed to us by customs, and we have a certificate to that regards, that this rice given to us is fit for human consumption before I even flagged off the distribution in Lagos State. We can give you that certificate maybe by tomorrow or later today. But let me also remind us that NAFDAC, Nigerian Customs Service, and the Ministry of Humanitarian Affairs, Disaster Management, and Social Development respect each other's mandate while carrying out our respective responsibilities. So, Nigerian Customs Service and NAFDAC, I'm sure, will sort out this communication gap and will report back to this platform once that is done. On the issue of the directives by Mr. President that we expand the social register by 1 million, that has begun already. As of today, we are at 3 million and projected to be at 3.1 million with the existing one that we have already of 1.2 million earlier on. And we're anticipating to reach a target of 3.6 by the middle of May. Ebonyi is now captured, which was not in the register before. Oguntu is currently being captured, which was the only state that really had not even begun to join the social register. And by next week, they'll be able to join the social register before we move them to the beneficiaries register. It's a question around the CSO. They have come out to say no palliative to people, that only CCT ongoing. Well, we have mentioned here that the CCT is an existing program. Mr. President directed in his first broadcast that we give 2 months advance. That could also be termed as a generous gesture as a result of the COVID-19 and the response. In the second broadcast, Mr. President also directed that we expand by 1 million again. On the issue of the CSO saying that they have written to ask for names of these beneficiaries, I don't know if you mean the beneficiaries of the cash transfer. Well, it's against the norms to actually publish the names of individuals that benefit from this government intervention or any kind of intervention. But we have a record, according to states, local government down to the community level, the number of beneficiaries of these poor and vulnerable households. And as far as the issue of the grains, we're all aware we're given 70,000 grains. As of today, we've been able to deploy 9,320 metric tons of grains to these 3 affected areas. That is about 334 trucks. While Kano is ongoing, 50 trucks are almost arriving in Kano. So this is what we have done as far as the issue of the grains is concerned. Well, I've mentioned the issue of the publication of these beneficiaries, as I have said, is against the norms and even against human dignity for you to, because you're supporting somebody, then you expose him to the public. But we have the record, state by state, local government by local government, and community by community. We have also aggregated to the level of the persons living with abilities, the percentage, gender percentage, heads of the households percentage. We have all that. You can go to the NASCO website, the National Social Safety Coordinating Office website, and you get that the details. You'll be able to answer all. Okay, the CSOs that said that they've asked for us, we have not even received any official request to that regard. As I'm talking to you, I've confirmed from the office, no CSO wrote to us that they wanted this information. But in any case, this is all we can even say. I hope I have answered all the questions raised. Thank you very much.
Thank you. Honourable Minister of Information and Culture. Yes, sir.
Thank you, Mr. Chairman, and the members of the task force and the gentlemen of the press. It is true that the creative industry is probably the most hard hit by the COVID-19. And this is because the industry, which creates so many jobs, has always been the fastest growing sector of the economy. As a matter of fact, apart from agriculture, it employed the highest number of people. Regrettably, with the COVID-19 pandemic, the industry has been very, very badly hit because the industry comprises travels, music, the film industry, theater, concerts, all kinds of industries that actually draw people together. So there's no doubt that this is the most hit sector of the economy. Before the pandemic, we were actually in the process of organizing the 3rd annual Creative Sector Week, which is normally is a platform whereby every stakeholder in the industry will come together and we plan ahead for the expansion of the industry. Unfortunately, with the COVID-19, this is no longer possible. So what we are doing now is that we're trying to set up a committee of key stakeholders in the industry to come up with urgent measures to keep the industry going. Fortunately for us, even before this pandemic, the federal government had put in place certain palliatives in quotes, that will speed up the growth of the industry. I'm talking about, the central bank creative industry initiative, which actually gives people in the industry opportunity to apply for loans between 5 million and I think about 500 million naira, depending on which part of the sector. I think this is an area that we need to ramp up now, and we need to continue to talk to the central bank on how the members of the industry can benefit from this particular fund, especially at this time. There's always been, both the United Nations, World Tourism Organization, and UNESCO, in the last couple of weeks, have been holding virtual meetings with all ministers of culture and all ministers of tourism on the way out of this, on the way out of this crisis. So it's a global issue. It's not restricted to Nigeria, and global organizations like WTO and UNESCO we have been meeting and talking to ministers and been providing solution. Very soon, we'll also very soon announce membership of the committee that would engage the central bank and engage other development agencies on how we can come out of this crisis. Of course, we are also spending the time in between to speed up the implementation of the digital switchover. The digital switchover is probably one of the best, cure to this, economic crisis, because when the digital switchover is actually on course, full cost, then it's going to create more jobs, in the creative industry than it is today. But the important thing is that we must also not forget that the federal government has also set up two other committees, one under the Vice President and another under the Minister of Finance, looking into which sectors of the economy are most affected by this pandemic, and how, even post-COVID, we can recover quickly. And I'm sure that the committee would take as priority the creative industry. We're talking about tourism, talking about music, talking about the film industry, talking about concert theater and travel industry. So we were hopeful that we'll get out of it. We'll continue our consultation with the central bank, with the development agencies, and also with the world organizations. Thank you very much.
Honourable Minister of State Education.
Thank you very much.
Thank you very much, and good evening. I think the question relates primarily to why our students on our scholarship in Russia haven't received their money. Knowing how far the news media is, let me just first of all use this opportunity to apologize to them. As many as haven't received their money, I think we have a few problems in just about two countries. Everybody else has received their money, and it's none of your fault. I think CBN suspended work on it immediately this broke. We at the Ministry of Education had signed off on all the remittances for the month. However, we expect that you'll be paid within the week, because I've heard and I've just confirmed on the phone from the Director of Scholarships that CBN is at work on it, and it should be implemented within the week. If you've incurred expenses out there, the Embassy and the Foreign Affairs Ministry are available for you to report, so that you can then be augmented for a while until you get your actual money, and you can then make a reform. we apologize on behalf of the government and people of Nigeria and wish you all well, wherever you may be. Thank you.
Thank you. We shall now take the chairman of the PTF, the SGF.
I think the first question here had to do with pensions. Somebody asked about the fact that I did request that if there were specifics, they should be directed. And the question was that retirees have not received their pensions. The information I have is that the contributory pension they have not been received since January. Yes, to some extent is correct. The simple reason being that the accrued rights of the pensioners is to be paid by the federal government and is presently being processed. When that is paid to PEMCO, then PEMCO would add the two. Because you know that we have been in a process of transition as far as the pension scheme is concerned. There are people that retired in January of 2019 that came with their accrued rights from the old pension scheme that will be merged with the new pension scheme. And that is being processed at the moment. And once that gets into the accounts of the PEMCO, they will begin to receive their pensions. Somebody did ask that, I think it was Channel reporter, about the fact that in the last dispensation there were no punitive measures for infractions on the guidelines. I believe they were. Those were the essence upon which the mobile courts were established. The mobile courts were not just to, caution people. There were some measures of punitive decisions that were taken. Some were fined. You heard about what happened in Lagos out of congregating for a house party. Some people were fined, and they were also directed to provide some kind of what you call public service label to go around educating people about the need for social distancing and also maintaining personal hygiene and the other advisories that the health experts have issued. So it will continue in the same line. I believe that in every constituency, in every state, there will be mobile courts. Like most of the governors in administering their restrictions, they sign the quarantine declarations as it affects their states. And in the quarantine declarations, definitely there are some punitive measures. But you see, the thing about this particular pandemic that we are fighting, you need a lot of buy-in of the community. And that's why, as much as possible, the tone should be reconciliatory. It should be a collaboration of the people with the government and the agencies of government so that we can decisively deal with this particular pandemic. And I believe that is the spirit we will take. Though enforcement in the next segment will be much, much stricter. That's why we are giving time for workplaces to prepare, to make sure that they make provisions available that would enable their workers come and they would have an enabling environment to operate in direct consonance with the advisories that have been given.